Good morning, everyone. I hope everyone is safe and healthy and is having a great break, which is a much needed break during these uncertain times. We are in the middle of the third wave in Sri Lanka, and all this began more than a year ago last year. And now we are finally at a point where vaccines have been rolled out to the public, to majority of the public. But as a part of oDoc, a lot of messages that we've been getting have been regarding the vaccines. Most of the questions around why do I need to get vaccinated? Why should I get my parents vaccinated? What is the importance of vaccination? How does it benefit the society? Which vaccine should I get? And loads of questions along those lines. So we thought to answer all those and to get a medical perspective on these questions, we have Dr. Milinda Salpitikorala with us. He's a graduate from Manipur University of Medical Sciences. He completed his registration at SLMC in 2007. He has worked as a casualty medical officer at RCU hospitals and Lanka hospitals in the emergency department prior to his postgraduate training in family medicine. He has a diploma in family medicine from Postgraduate Institute of Medicine from the Columbia University in 2014, for which he was nominated for the Silver Medal of Excellence. He is also an international member of the Royal College of General Practitioners UK and is currently following the postgraduate MD in family medicine by thesis at the Postgraduate Institute of Medicine, University of Colombo, Sri Lanka. Doctor, welcome to our webinar. It is a great pleasure to have you, and thank you for taking your time to answer which I think is the most asked question of our times.
Thank you. Thank you for inviting me, Shivanki.
Thank you, Doctor. So without any delay, I'm going to go straight into the questions, Doctor. So the first question we have is how can, okay, so basically we have all the vaccination drive that's happening all over the country. How can people who go there be safe? Because it's like crowded there. So how can people be safe there?
Okay. So going for your vaccine, there's no difference as opposed to going to the supermarket. So you need to follow the social distancing guidelines. You need to use your face mask. You need to sanitize your hands. And with having limited vaccines, I know everybody tries to go and then try to get in. Maybe they'll run short, but I think eventually we will have enough vaccines for everybody, and there'll be a systematic way that vaccines will be distributed. So I think being safe at vaccine drives, it's not any different than going out to buy anything else. So you need to follow all the rules. And when vaccines become more and more available, and I think then they'll have easy access to it, and then there won't be so much of a crowd.
Great, thank you, Doctor. I think you gave all of us a little bit of hope, saying there will be enough vaccines for everyone. So thank you for that. Yeah. Another question that we've been getting very often is, in the recent past, is obviously there's two main vaccines that everyone is talking about, which is the Chinese one, which is Sinopharm, and the AstraZeneca one, which was given, and now Sputnik. So how are all of these different from each other, Doctor?
Well, let's start with AstraZeneca. AstraZeneca is we got the one which was manufactured in India, and AstraZeneca, the vaccine, it's we call it a viral vector. That means part of the virus is it's introduced into another type of human, or in this case, it's a chimpanzee virus, a part of the coronavirus, so that it can replicate the spike protein and invoke a response, an immune response. So basically what all that means is that a part of corona is inserted into your body. So it's like you're training the body to fight off corona when it really comes. So the difference between, let's take the other one, next one we got was Sputnik. Sputnik is also a similar type of viral vector, but whereas it uses two different carriers to carry the the corona DNA or into the corona protein and invoke a immune response. But the difference between AstraZeneca and Sputnik is that Sputnik, the two doses are different, whereas AstraZeneca and even Sinopharm, both doses are exactly the same. It's you can so in Sputnik, dose 1 is different from dose 2. It's not the same.
Right, got it.
Yeah. And say Sinopharm is different from all of the others because it's an inactivated whole virus, whole coronavirus. So it cannot replicate or cause any harm, but it's an inactivated virus. So it's introduced into your body, and then that invokes a immune response, which we call immunity.
Great, great, doctor. Thank you for that clarification. I think it's helped me and a lot of people who are watching also. Moving on to the next question, doctor. What exactly does being vaccinated really mean? Does it mean you won't get infected after you get the vaccine, or does it mean you won't get sick? Like, or does being vaccinated mean I can now stop wearing a mask, which I think a lot of people are asking?
Yeah, well, vaccination means that you're protected to a certain degree. Now, let's take the 3 vaccines we have. It's called AstraZeneca, Sputnik, and Sinopharm. So AstraZeneca gives you 60 to 90, depending on the different studies, 60 to 90% effective, and Sputnik is about 92%, and Sinopharm 79 to 86 with the limited information we have. So this percentage means mostly of hospitalization or severe corona. So so it doesn't mean you can't get it. You can get it, but the morbidity, mortality of uh, uh, from corona is going to be much less. So and it also, we don't know whether we don't have enough evidence to say whether you can transmit or not. So whether you are vaccinated or not, you have to still, until we have more evidence, you have to still follow the social distancing rules and the masks and all.
Of course, doctor. I think even after, so I think that's a really important message there. So even if you are vaccinated, single or second dose, it's always safe to follow the guidelines that's given to us.
Yeah.
Doctor, how long can the first dose response last in the body, and what happens if we can't get the second dose in time, which is the case with some people here at the moment? Do we need to start all over again if you miss the 12-week period?
Well, so there's some evidence that there's you have a certain amount of immunity after the first dose. So far the studies have shown us about 90 days, that's 3 months. After that, they say the immunity starts reducing, but that we don't know. We haven't done enough research to say a certain period of time. So for now, the data we have is 3 months. And there's also, they're doing some studies regarding the mixing of vaccines. Say first dose AstraZeneca, second dose Sputnik, but we haven't got the results yet. So we don't have any concrete data to formulate a guideline or give anything on that regard. But however, most vaccines need a booster dose, that is the second dose, to give you proper immunity, because the first dose is not enough. And I think the government is also working to get the AstraZeneca doses for the missing people, and I'm sure it will arrive soon. But just in case you've missed it, probably you'll have to start again. But we still don't know the guidelines regarding that, because everything's still new, you see. So the moment data comes in, the authorities, WHO, CDC, they'll put out some guidelines, and then our health ministry will go through their panel of experts and give us what we should do. and I think there'll be a solution. I'm hopeful.
Great, Dr. Singh. We also we also hope for that only.
Yeah.
Moving on to the next question. What advice would you give to the public, especially at uncertain times like this?
Yeah, that's very important. Lots of people have been forwarding me messages, sometimes consulting me regarding what they should do or shouldn't do to prevent corona. So I have there is some amount of data with vitamin C and vitamin D. So in prevention, but nothing concrete. We know that people who have had low vitamin D levels have a chance to get more severe corona. So, that's why everybody's supplementing vitamin D. Also, but there are lots of fake messages and fake instructions saying to breathe a certain way, to steam 3 times a day. And so I've had a patient on this digital platform itself. Um, she had a fainting attack after trying to breathe a certain way to prevent corona. So that has no medical or scientific basis, and it's basically rubbish. So even steaming is good for you for sinus and other illnesses, but it's not going to prevent corona. So I've had also some patients having tongue injuries and burns in their mouth, drinking hot water the whole day to prevent corona. So what I would suggest is, everybody, when you get a message like this with somebody, it seems like you want it says also to forward, you may help everybody. So do a fact check.
Sorry, doctor, I think we've lost you there.
Okay. So yeah, I was saying, to every time you get a message saying to forward it, or you may help people to do a fact check, to go on Google and see if these things are correct, and it'll give you can do a fact check. There are lots of websites, and before forwarding, please check and don't follow blindly. Ask your doctor or physician. I'm sure you'll have a contact, and yeah, that's very important. So don't do anything blindly.
Yeah, doctor, I think that is super, super important, because we've seen a lot of people just forwarding messages, and at times like this where everything's uncertain, maybe just taking a minute to just see if it is factually correct will help reduce the chaos that's going on around us within our families, and like actually help people from getting more stressed. So thank you for that, doctor.
No problem.
Sorry, I was on mute. Sorry, doctor. Okay. So I think that brings us to the end of a very short but an extremely important and useful session, doctor. So thank you so much. There were some great takeaways from this session, such as just taking a minute to fact check before you forward things. There's waiting for correct and valid information from reliable sources, which will be given out regarding mixing vaccines, or regarding what symptoms to look out for or what to do. I think it'll be great if all of us can look at very reliable sources for this information. oDoc, as a part, I would say, has always been giving out very reliable information to people. So you can always look at our platform for more information on the vaccines or about what to do with COVID. At the meantime, if you guys who are watching would like more medical advice or have more questions regarding vaccinations or COVID or what's happening about just your general health, you can always consult Dr. Milinda on oDoc. He is available on the platform. So having said that, doctor, I would like to thank you for taking the time during your busy schedule. I know you've been really busy with everything that's going on. Thank you so much for taking the time to educate me and everyone else who's watching. Thanks a lot, doctor.
Thank you. Thank you. Take care.
Thank you, doctor. So guys, we've come to the end of it. So as always, be safe, just be indoors. If you're having any difficulties or any symptoms of COVID, please consult a doctor over oDoc. You can always speak to them while staying home without going outside. So I will meet you guys again in a few weeks with another important and very informative webinar. So until then, thank you so much. This is Shivangi from Team oDoc signing off. Thank you.